Hi, Tim Russell here for Inovera Bioscience and Forvia Vitamins. Today we'll talk about a common problem for all of us sometimes, and that's feeling tired. For most folks, tiredness or fatigue is fixed with a little rest and adequate diet. But for some medical conditions, like inflammatory bowel diseases, Crohn's, and colitis, that can bring on fatigue that's not fixed just by rest. Some bariatric procedures also contribute to fatigue, and more about that in a minute. Now, one cause of fatigue from inflammatory bowel disease is iron deficiency anemia, or lack of iron in the blood. Iron carries oxygen in red blood cells, and low iron means less oxygen available. That makes you feel tired. The second cause of chronic fatigue is anemia of inflammation, a condition where inflammation disturbs the utilization of iron, even when blood levels for iron show normal values. A third cause of fatigue can be low vitamin B12. This vitamin is essential for forming red blood cells. Low B12 can lead to low red cell counts, and that means less oxygen carried in the blood. Now, things you can do are to be sure getting enough iron in your diet or from vitamin supplements. Your doctor can test for iron levels. If you are low on iron and need a supplement, you may find that high doses of iron can be hard on the stomach. If so, look for lower dose vitamins such as Forvia, which contains 15 to 20 milligrams in the daily dose. The second thing you can do is to be sure of getting enough B12. Diseases like Crohn's affect the last part of the small intestine, called the ileum. Normal absorption of B12 takes place there, so disease or surgeries in the ileum can reduce absorption. Some bariatric surgical procedures can reduce capacity for absorbing B12 too, because the stomach produces something called intrinsic factor. And that's needed for B12 absorption in the ileum. So both reduced intrinsic factor and diseases of the ileum mean that B12 absorption from foods reduced. Your doctor can test for low B12. And supplements are available either as monthly shots, nasal sprays, and in tablet and chewable forms. For tablets or chewables, look for supplements like Forvia that provide about 1,000 micrograms of B12 in the daily dose. If you'd like free information on B12 that discusses more about deficiencies and the conditions that can cause them, email info@inovera.com and ask for our vitamin B12 white paper. That's info@inovera.com, vitamin B12 white paper. Thanks for viewing.